This is a presentation about mental health services and pathways in Bromley for school mental health leads, covering support available for school mental health leads, Bromley's single point of access, that's the SPA and how it operates, when and how to make a referral, and support that can be accessed at the universal level. Hopefully it will help you to feel as clear as possible about what's available support-wise in your role as mental health and wellbeing lead. So in terms of SEMH, that's social, emotional and mental health needs, it's one of the 4 areas of the SEN, that's special educational needs, identified in the SEND Code of Practice. The Bromley SEN advisory teams offer a single point of contact, that's SPOC for CYP, at both the SEN support level or at the education, health and care plan level. Advice, guidance and support can be accessed via this SPOC very quickly. In the first instance, you may want to discuss an anonymous case or seek general guidance for a cohort of children. After discussion, a more formal referral may be appropriate and parental permission will be required. Earlier this year, Education Matters produced the Mental Health and Wellbeing Toolkit to help schools. It's a key part of London Borough Bromley's support to school colleagues and a collaborative effort with mental health partners and is updated regularly. It's developed with local education settings in mind to be a one-stop shop for mental health and wellbeing resources and information for education leaders, teams and staff. And it includes information on how to support pupils, colleagues, staff and yourself when it comes to mental health and wellbeing. Alongside this, there's the Bromley Education Department website with lots of resources and training support. And examples of these documents on there include the Graduated Approach Framework for SEMH needs, the Emotionally Based School Avoidance Toolkit and SEMH resources to use with pupils, parents, carers. Right, during the onset of the recent pandemic, London Borough Bromley teams worked in collaboration to offer each school a named point of contact across teams. While there are a range of different services in the area, the core mental health and wellbeing offer for children and young people in Bromley centres on the provision by Bromley Wise CAMs. This dual service model was established in 2014 and there's been strong partnership working between these 2 services ever since. At the heart of this NHS voluntary sector partnership is the single point of access, the SPA, which is managed by Bromley Wise. We're now going to take a closer look at these 2 services. So Bromley Wise was set up in 1965, funded by the YMCA and known as the Bromley Youth Project. It's evolved over the years and is now a accredited CYP IAP service, meaning it uses evidence-based interventions to work collaboratively with young people. The support is offered. The support that's offered is traditionally referred to as Tier 2 support, which focuses on early intervention and support for children and young people presenting with mild to moderate difficulties. Bromley Wise had different names over the years, but in essence, between 2014, it was known as the Bromley Community Wellbeing Service. More recently, since 2019, with the introduction of the Trailblazer, that part of the service was named the School Wellbeing Service, now the MHSTs, Mental Health Support Teams. And then a new service was commissioned by London Borough Bromley and Bromley NHS CCG, and on the 1st of April 21, we relaunched as the Mental Health and Emotional Wellbeing Service for children and young people. For ease, though, we now refer to all our branches of our service as Bromley Wise. CAMs are a multidisciplinary specialist service which operate under the Oxley's NHS Foundation Trust. They offer a range of interventions for children and young people whose SEMH needs are more complex, persistent, and/or require longer-term intervention. They're mainly for children and young people who've already accessed support and interventions via school, Bromley Y, Bromley Children's Project, etc. Young people who present to A&E due to mental health crises will be assessed by the Oxley's crisis team, which operates across Bromley, Greenwich and Bexley. Otherwise, all referrals to CAMs come in through Bromley Y and the SPA and are considered for the following teams. The generic team, who support children and young people up to the age of 18 with a broad range of issues around their mental health. The adolescent team for 13 upwards, who might need more intense and frequent interventions. And the looked after and adopted children team, who work directly with those children who are fostered, adopted in kinship care or under special guardianship orders. And then there's the neurodevelopmental and learning disabilities team that specialises in supporting young people with diagnoses of ASC, ADHD or learning disabilities. Once allocated to the appropriate team, the child or young person will initially be placed on a waiting list until offered an initial assessment. During this time, if there's any change to the child's or young person's mental health, there is a duty service in CAMs ready to receive calls and offer support as needed. They also have a care coordinator who is in charge of providing a core intervention. All children and young people needing assessment and treatment from mental health services at Bromley Y or Bromley CAMs should be referred to Bromley Wise Spa. That's the single point of access. Bromley Y and CAMs professionally meet daily to discuss referrals and whether they need support from Bromley Y, CAMs or other services such as Bromley Children's Project, maybe for family support, typically around challenging behaviours and difficulties at home, Bromley MenCap perhaps for ASC support, or maybe the Candle Project for children experiencing bereavement. There are many different presentations that can lead to a referral, but these are some of the most common ones. We know there's a high level of comorbidity between mental health difficulties, so it's not unusual for a young person to be experiencing more than one of these. It can be helpful to reflect on which difficulty might be at the root of the problem. For a referral to be made, we would expect that the difficulties were having a significant impact on their life at home, school, and/or with peers. To make the SPA as accessible as possible, we do not restrict who can submit a referral. The easiest way to refer is via the online form on our website. If for any reason this does not work for you, you can also download Word and PDF versions of the form and email them to us. The full list of our referral options and pathways are on our website. Before you make a referral as a school professional, you will need parental consent and ideally consent from the young person as well, as it is important they are willing to engage with our service. You will also need to have a demographic info such as date of birth, address and contact details, ethnicity and registered GP. Please provide as much info as you can, as this helps us with triage to ensure we are able to support the young person as soon as possible. It's very helpful to note things like key difficulties, their duration and impact, any previous support accessed and the outcome of these, significant risk factors involved, what you hope the young person will achieve as a result of the referral, for example, increase the capacity to cope, learning to manage worries, be able to socialise more with peers. There are some referrals that are not covered by the SPA. This doesn't mean that we won't work with children or young people with these difficulties, just that we are unable to assess and diagnose. Additionally, if the presenting difficulties are better explained by issues relating to ASC, ADHD and EDs, eating disorders that is, Rather than mental health, we feel these should be addressed first before engaging with therapeutic intervention. Please note that Bromley Y is not a crisis service. While we do risk assessments and safety plans as part of our routine work, if you have genuine concerns that a young person might seriously hurt themselves or have plans to take their life, it is not appropriate to make a referral as more immediate action is needed. As you can see from the 3 slides, there are 3 boxes up there. Make sure that the young person is with a trusted adult. Encourage simple, soothing or distracting activities. Contact a crisis service for further support. Included in this is the Oxley's 24-hour mental health urgent advice line, which professionals, parents, young people can call. Remember, if someone has imminent plans to hurt themselves and you no longer feel able to keep them safe, it is an emergency, so take them to A&E or call 999 for help. What support can be accessed without a referral? Providing a strong universal offer for children and young people and their families in Bromley is something we at Bromley Y are passionate about and continue to develop. Schools under the MHST programme have access to regular consultations through pupil of concern meetings and can book in universal and targeted workshops without referrals. Bromley Y run a range of open access webinars to support children, young people and their families in the Bromley Borough. Every month we run webinars for parents on managing anxiety in their children, as well as webinars for young people on anxiety, worry and low mood. These sessions focus on increasing understanding, identifying maintenance factors and offering practical strategies and advice to try. Attendees switch their video and audio off and they contribute via the chat function. Pre-recorded versions of our parent webinars can be found on our YouTube channel, where there is closed captioning available to provide subtitles in different languages for EAL parents. On there, you will also find some workshops we have delivered for school staff and assemblies for children and young people that may be useful. A new part of our universal offer was the launch of the signpost earlier this year. This is a free confidential text service for young people, providing them quick and easy access to a Bromley Y practitioner. Children and young people can text us with questions about mental health, ask for tips and strategies on managing their difficulties, or ask for advice on what to do next in their situation. We can forward resources, links and point them in the right direction, whether that is a referral to our service or seeking support elsewhere. Note that this is a service where the texts are monitored 9 to 5, Monday to Friday, not bank holidays, and is generally for text support for 11 to 18-year-olds, secondary school age. Sometimes young people just need to be guided in the right direction, but are not ready or appropriate for formal therapeutic support. Helping them find online support can be really helpful for them and allow them some independence and choice over their well-being. Tooth is an example of a mental health support platform that is being widely used around Bromley. For some kids, ensuring parents have access to support and self-help can be just as useful, particularly for children and young people presenting with challenging behaviours or school avoidance. Bromley Children's Project run a parenting hotline that can be accessed. If you have any questions about Bromley Y or referrals, please visit our website, where you will find more information about our service, as well as options on how to contact us. I hope that presentation was useful. Thanks for listening.